Hello everyone, welcome again to Device Engineer X, and today we're going to the second part of this series that I've started, Medical Device Electrical Safety. And if you remember from the last episode, we spoke about just the general hazards associated with electrical handling with electrical safety in hospitals and just in general in the workplace. And in today's episode, we'll discuss the physiological effects in the occurrence of an electrical shock. And we'll go over three types of physiological effects, three main common ones, which is electrolysis, burns, and muscle spasms, which leads to tetanus. And we'll just go in depth on each one. But before we discuss those three types of physiological effects, we first need to understand how an electrical shock occurs. So, as you can see in the diagram, in the first picture of this man standing right here, there's no contact with the energized live conductor, just the ground coming from the mains. So there's no electrical shock. However, the moment he touches that, so this fault could be from anything really. It could be for poor grounding of an electrical equipment, or just misuse of medical electrical equipment, or it could just be a damaged wiring of a plug, which is a very common one. And if there's an open live wire in that wiring, that could be a potential contact. And once that happens, this forms a closed circuit, which can, of course, create an electrical shock. And how does this relate to our jobs as biomedical engineers in the workplace? Well, if you see this picture here of a patient lying on a hospital bed, if there's poor grounding on that bed, and that patient is attached to either an ECG or an active part of a patient monitoring system, as you can see from here, this could create an electrical pathway and cause an electrical shock. And it only takes a small amount of electrical current to actually, if it goes through the heart, create an electrical shock. So preventative measures is crucial, which is what the role of medical engineers do in hospitals. So we'll go to the first form of physiological effect that we'll go over with, and it's called electrolysis. And electrolysis is the process by which electrical current passes through a substance to affect a chemical change. That's the definition of electrolysis. And in terms of the physiological effect, there are minor forms, and the minor forms can lead to hair loss and minor skin damage. And if prolonged exposure to this current, this could form ulcers when applied to the skin, and this can cause decay or tissue damage. And of course, with excessive exposure, this could worsen the ulcers, and potentially it could cause infections and complications to the individual. Next is burns. So with burns, in this picture, there's three different types, but there's actually a fourth degree of burn that we'll go over with. And burns just happen when heat is generated by the electrical current, which damages the skin and underlying tissues. As I've already mentioned, heat generated by electrical current can induce burns. And as you can see from that illustration, it just shows how the different layers in the skin is affected by different degrees of burn. So with the first degree of burn in this picture, this only involves the top layer of the epidermis. So it's only a superficial burn. And the characteristics of the burn can include redness, just mild swelling, and probably very mild pain. And normally there's no blisters that are associated with first degree burns. And in terms of the healing time, with first degree burns, generally they only heal within a week, and there's normally no scarring involved. So with first degree burns, it's just this layer here, just the epidermis. And now with second degree burns, this includes epidermis and the actual dermis layer. And with this one, there's more swelling and there's more severe pain with the affected individual. And in terms of healing time, it's a longer healing time, and potentially there is scarring as well. In this last picture is third degree burns, and now this extends to deeper tissues and actually might include the fat layers beneath. With third degree burns, they normally require immediate medical intervention, and it could possibly use skin grafts, which is just transferring of another skin to the individual, and this normally is associated with a high risk of scarring. Now I want to note that there's actually a fourth degree burn which extends beyond the skin, and this normally affects the underlying structures and muscles, and this normally involves complex treatment and surgery. Now the burns is of course associated with the different degrees of burn. It's normally generated by factors depending on voltage and frequency. The higher the voltage, the higher the frequency, the higher degree of the burn. Lastly, we have muscle cramps and tetanus. We've slightly went over this in the first episode. But with tetanus, as we've discussed before, to give a proper definition of tetanus, it's a condition that happens from prolonged muscular action, often associated with muscle spasms and contractions. So in terms of physiological effects of muscle cramps, tetanus begins with mild spasms, including lockjaw. There's breathing difficulties. There's prolonged tetanus, which is very painful. And I think I've experienced this one time in the hospital setting when we were handling servicing a lamp. Well, it was a ceiling lamp, and I believe there was an exposed wire behind it. And if that occurred, if the person I was working with, he almost touched the end, that could have led to a prolonged tetanus. And what that means is when they would have held on that energized life conductor for a long time, which could lead to really severe injuries if not treated straight away. Now, another form of physiological effect is cardiac arrest. When the current goes in contact with the heart, which can lead to ventricular fibrillation and cardiac arrest. So in this episode, I just wanted to go over with the different types of physiological effect of electricity. These questions normally come up in interviews. If you apply for jobs here in the UK in NHS, I've experienced it before a couple of times when they discuss different effects of electricity. And this is just knowledge that's very important for engineers to know, the hazards associated with handling with electrical equipments, and knowing the precautions that we need to take. And in the next episode, the next part of the series will be going over electrical current. Thank you guys for watching, and see you in the next episode.